Welcome back to my channel. So today, get excited. We're going to start the weekly discussions about bariatric surgery. So what I'm planning to do is to go over a few of the most Googled questions that I did in my longer video. I'm going to go over those more in depth. And then I'm also going to go over some of the most common patient questions that I've had this week. So without further ado, what I'm going to do today, we're going to talk about how to get started with considering bariatric surgery. So again, when we talk about bariatric surgery, we're talking about the gastric sleeve, the sleeve gastrectomy, the gastric bypass, or the Roux-en-Y gastric bypass. Sometimes we'll do the duodenal switch. Occasionally we'll do the lap band, but personally where I work now, we don't do those anymore, but in the past we did. So now we do lap band adjustments. And then those are basically the most common ones that we do. We also do revisions where I work, and a lot of places now are doing revisions for bariatric surgery. So we're just going to talk about the general first time going through bariatric surgery, what to expect from a patient point of view. So as I had touched on in my previous video, we have to start off with body mass index. So whenever you're considering looking to have surgery, we talk about body mass index, and it's not the most perfect way to measure the disease of obesity. It's not the most perfect way, but unfortunately, this is how we classify it in order to decide if a patient gets medication or if they get surgery. And so same thing, insurance companies for now are always going to look at the body mass index in terms of if they will cover bariatric surgery. So the interesting thing is that since October of 2023, they have lowered the body mass index needed to qualify for all bariatric surgeries, because it's been shown that bariatric surgery versus just weight loss alone, so just metabolic medical weight loss, meaning with a medication or without a medication, just diet and exercise, it's been shown that bariatric surgery can actually help more to resolve diseases related to obesity. And when I say diseases related to obesity, that's referring to comorbidities. Those are comorbidities of obesity. So those are things like diabetes, high blood pressure, high cholesterol, sleep apnea, fatty liver, arthritis, sometimes heartburn. Those can all be considered comorbidities. So when we're looking for just the body mass index, we're talking about kilograms over meters squared. So it's something that you can figure out on your own as long as you know your height and weight. So that's where to start. And the usual recommendations in the past were that a patient needs to have a body mass index greater than 35 with a comorbidity, or body mass index greater than 40 to qualify for bariatric surgery. But now the standards have changed, and all that's needed is a body mass index greater than 30 in order to qualify for metabolic bariatric surgery. So will insurance companies approve this? We don't know, but those are the new recommendations. So, or should I say, will insurance companies apply this? We don't know, but these are the new guidelines, and so they probably will be adopted in the next year or two. So that's pretty encouraging, because you never want to have to tell a patient, you have diabetes, you have high cholesterol, but your body mass index is only 32, and so we can't do anything better for you. Or, you would never tell a patient to gain weight, but truly, sometimes patients have asked me, well, do I just need to gain weight in order to qualify for surgery? And I would never say yes, but it's basically like telling them that that's what they have to do. Another thing to bring up with body mass index, and this has changed also, is that for Asians, body mass index is lower. So body mass index to qualify for these different classifications. So with an Asian population, and the reason for this is because people in the Asian population will develop these comorbidities at a lower body weight than other populations. So Asian people with a body mass index greater than 25 are considered overweight, and then greater than 27.5 are considered obese. So any patients that are Asian will qualify for bariatric surgery if their body mass index is greater than 27.5. So that's just where to get started. And then usually the first step is to make an appointment with a major medical university. And in most cases, you'll meet with the surgeon first. So you'll meet with a surgeon, and most likely you'll attend some kind of information session that makes sure that you understand the process. And then also insurance will be verified at that visit. And then what's called medically supervised weight loss will start to occur. So you meet with the surgeon, and then medically supervised weight loss is where you meet with the dietitian and the bariatrician. So I'm a bariatrician, so that's what I do. I do the medically supervised weight loss prior to bariatric surgery. I also take care of patients after bariatric surgery. So that is what is required beforehand. It's also required that patients undergo lab tests and some imaging of the inside, their anatomy on the inside, usually like an upper GI barium swallow where they drink barium and an x-ray is taken, or sometimes like an EGD, which is basically like a colonoscopy, but it's a scope. So that's the EGD, and that's done as well. So blood work, workup, seeing the dietitian, seeing the bariatrician, and then it's also required that all patients see psychology. And a lot of patients will ask me, well, why do I have to see psychology? And the reason for this is not to postpone the surgery. It's not to, make them be afraid of having surgery or to put one more obstacle in the way. But the reason why they have to see psychology is because psychology has to make sure that they understand, that the patient understands that this is actually an elective procedure. This is not medically necessary. This is an elective procedure that the patient is going to undergo. And it's not just like, getting your gallbladder removed or your appendix removed. This is a procedure that even after that day of surgery, even after that week of surgery, your life is going to change completely. How you can eat, the fact that you have to take vitamins, and we'll get into all these things in upcoming videos, but all these things change. So they have to understand, the patient has to understand that new lifestyle that's going to start to occur. And then not only that, is that some patients will use food as a mechanism to control their feelings. So like emotional eating is extremely common in our population and in most populations that we see that are undergoing issues with weight. So another form of stress relief has to be put into place in order for a patient to really be good long-term with this surgery. Because with all the surgeries that I had mentioned at the beginning, the stomach is made smaller. So you physically cannot eat as much as you were able to in the past. So overeating will not only stretch the stomach, but it also obviously has worse outcomes in terms of undergoing the surgery and then the actual weight loss that can occur long term. So that's where to start. And then I just want to go over the patient question of the week is, when will my surgery be? So this is a question that when I saw my patients today, I got asked. I think every single patient asked me this question. So basically what I tell them is they have to finish all of the requirements. And at least at our institution, not only do they have to check off all those requirements, check them off on the list, but they also have to be approved by everybody. So they could see the dietitian 12 times, but if they're not following what they're supposed to, then they're not going to be approved by the dietitian. Same thing with myself. If they're not medically if they're not medically ready, then I'm not going to approve them for surgery. Same thing with psychology. Patients get nervous when they have to have a few visits with the psychologist. And I always tell them, it's not to punish you. It's because we just want to make sure that you are ready for surgery psychologically and that you're going to do well in the long run. So once all those visits are done, then the insurance, our office submits the paperwork to the insurance, and we get a date or we get a letter of approval. Then the surgery office will contact the patient and they meet again with the surgeon, just like they did at the beginning. They meet again with the surgeon, and then a date for surgery is decided on. And that's when they also will meet with anesthesia, go over any of those kind of things, go over medications that are going to be stopped, just like any surgery. The only difference with this surgery is that patients not only have to undergo that medically supervised weight loss before surgery, but they also have to undergo a 2-week liquid diet. And this is another question that I get all the time is, do I actually have to do this 2-week liquid diet? And the purpose of that, so the purpose of this 2-week liquid diet is to shrink the glycogen stores in the liver. Why do we have glycogen stores in the liver, and how are they shrunk? So the liver can sometimes become fatty, and that means that it's enlarged and has excess fat, just like all the organs can have when a patient is dealing with the disease of obesity. So most patients will have a fatty liver when they undergo surgery. It might not show up on their blood test, but a lot of times it will show up on imaging, and they just have a fatty liver just shown if they were to go into surgery without doing that pre-op liquid diet. So we do the pre-op liquid diet because it's basically it's kind of a misnomer, pre-op liquid diet. It's not really like full liquids. It actually, there's protein in it. So the purpose of it is it's really just a low carbohydrate, high protein diet. And the reason for this is to shrink the liver. So when you have, just like, you will lose weight if you go on like a low carbohydrate, high protein diet because of a lot of the water weight. Well, a lot of glycogen stores are depleted when you go on this low carbohydrate, high protein diet before surgery. And that actually shrinks the liver so that the surgery can be done safer and quicker. And I forgot to mention at the beginning, now, for many years, most of these surgeries are done through laparoscopes. And a lot of them are done with robots. So the laparoscopes are basically just a few small incisions instead of one big open incision. Many benefits to that. The surgery itself is so much safer. The hospital stay is much quicker. The recovery is easier, much less risk of infection. So tons of benefits. The only thing that becomes a little bit more difficult is obviously it's a little bit more technically challenging for the surgeon to go in through small incisions rather than one big incision. So having a big liver in the way really gets in the way of the surgical technique. So that's the purpose. So after all those things are done, then the patient can go ahead and have surgery. And in the upcoming videos, I'll get into more details about that, as well as going through a lot of the patient questions that I get asked on a daily basis. And again, thank you for watching. Please subscribe for more. I'm going to be doing these weekly. And not only do I look forward to sharing my patient questions with you, but you can definitely ask me any questions below, and I will address them in the comments, and then I'll get into more detail in upcoming videos. So thank you so much. Please subscribe and enjoy the rest of your day. Thanks.